On behalf of Access to Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health, welcome to today's Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. GW's Office of Integrative Medicine and Health provides professional development, education, and community outreach to improve health and wellness. Today's facilitators are Misha Kogan, MD, founder and executive director of AIM Health Institute, and the medical director for the GW Center for Integrative Medicine, and a whole bunch of other titles that Misha has. Our special guest who will be doing our mind-body practice today is Luci Gabel. Luci has an MBA, an MA, and a bunch of other initials after her name that she can tell you about. But most importantly to us, she is a leadership optimal performance coach. Dr. Kogan will give the wellness talk and answer your COVID-19 questions, and Luci will do the mind-body session. Okay, over to you, Dr. Kogan.
Thank you, Janet. Thank you, Office of Integrative Medicine and AIM Health for hosting us as usual. So my quote-unquote sarcastic wellness talk today is not much of a wellness, but for what it must. So the mutations, there's two articles that are posted in the chat. The first one is the Washington Post article that describes the genetics. So kind of interesting part that I do want to specifically talk about. There's two different parts of the genetics. So one is genetics of the virus, and there's a lot of attention to that, meaning that the virus seems to be mutated. You may have seen some posts on Facebook and whatever, that there's a concern that somehow mutated virus will be bypassing masks and social distancing and all of that. That's a high-end speculation that most likely irrelevant. But the point is the virus mutates. We knew this. There's nothing new. The study that the Washington Post describes specifically simply analyzed groups of mutations over the past few months that have happened to the virus. There are only very few that actually are concerning. Majority is simply, we don't even know if they do anything at all in terms of changing the way a virus behaves. However, I think that there are kind of several precautionary tales here. Number one, the rate of mutation may potentially affect how the vaccine development is going to occur. So, for example, it's possible that even if one of the vaccines, which is next topic of discussion, going to get created soon enough, let's say in 3 to 5 months, it's very possible that in 12 months or further out, the vaccine will have to get continuously modified. But if you think about that, that's not actually very different from the flu. Every year, the flu vaccine is modified because the virus mutates, and there's an expectations of that to be a standard of practice, of just a norm, right? So that's first. So I don't really, I just want to say to everybody, I don't think we should be reading this article on mutations as something, oh my God, oh my God, oh my God, the virus is going to get more severe. There isn't really any clear evidence of that happening. Virus simply going to slowly select the mutations that are more beneficial, but this process will be slow, and it's unclear whether or not it's going to translate to a shift in the behavior or the treatments for that matter. The second, which is not in this article, but it's a pretty interesting read. I actually lost that link. I apologize. It's an information of the which genetic mutations more accurately predispose people to a high risk. So the researchers did something quite smart. They took brothers who have specifically gotten really sick, picked a series of identical twins basically, and analyzed them. And turned out that one of the key features of what increases predisposition to the severity and to infectivity is a lack of production of interferon. We may have touched upon this when we talked about certain natural methods of optimizing interferon. I don't know if I talked about this, but there's a Russian natural medication that's been in the market in Russia for over a decade that is actually targeting interferon. It's been used in Russia for almost all the viral infections. That's pretty interesting. Currently, I have not seen Russia advocating for use of that medication, but it's available in entire Europe. There are also natural things like, for example, vitamin D that does have some benefit for optimizing interferon production, and exercise also seems to have some impact, although much less. And I do know that there are several drugs in development that are trying to boost their interferon as well. So, other things that interestingly boost interferon, that's really interesting. So both extreme temperatures, both extreme heat and extreme cold. So those of you who are my patients know how often I advocate for you to take your morning with a cold shower. Turned out there's an actual reason for that on an antiviral basis, and that is that it does tend to stimulate interferon production. So I'll end that part on a positive note, okay? I'll try to end on a wellness part for each part. Okay, so the second part is those of you, we've talked about complications of vaccines last time. Those of you who are following Dr. Fauci have probably seen that he's becoming increasingly more skeptical of the successes of vaccines, and he gives us a lot of caution, saying that by no means a creation of the vaccine is going to mean that we will ease up our precautions, that we will decrease social distancing, mask use, etc., and that there may be, we hope for the vaccine to be at the best 50% efficacious. And of course, with the AstraZeneca vaccine being on hold due to a severe complication, neurologic complication called transverse myelitis, it's really unclear what the future of that specific vaccine is. There currently, I have to look this up. Actually, you can look this up if you click on the New York Times link. They tell you how many vaccines are there in the phase 3 in the last clinical trial. I believe it's 11. And as you, of course, know, none have been approved. But this specific New York Times articles that's in the chat is about a very significant progress of Johnson & Johnson vaccine. It's an old type of vaccine using adenovirus as a carrier, as a vector. And there's two big advantages if this vaccine succeeds. One, there's only going to need to be one shot, not two. And second, this vaccine will not need to be frozen. It's actually quite a big problem if you have to freeze vaccines and deliver them in the frozen form to each patient and thaw it out of the freezer right before the injection. That just makes logistics of administration very complicated. So having a vaccine that is simply sitting in a fridge, like flu vaccine and most of other ones, would simplify things quite a bit. So Johnson & Johnson, even though they're just entered this week phase 3 trial, and it's a large trial, and they don't expect any results before the end of the year, but that's one positive note there. Of course, everybody have been seeing the mess that CDC has created by first putting statement about not needing to test patients who have been exposed and asymptomatic, and then they retracted that statement. Then there was a statement about airborne spread. Seems to be kind of all over the place. Frankly, I would say if I were you, or my position on this, just ignore all this back and forth. I don't think anything changed in terms of the basic precautions except one thing. And just like if CDC can retract their statements, so can I. So that makes me feel better. So I'm retracting my statement that absolutely no need to use an eye protection. Turns out that those of you who've been following news, there was a sudden local spread in Brigham Hospital in Boston, and they believe that it actually was due to them not using the eye precautions and spread through the eye contact. So I think our hospital system is taking a new approach, which is say that if you are in emergency room or in any situation where you don't know the patient you're going to see, you should be using some kind of an eye protection. Turned out that even regular eyeglasses could be sufficient. But most people advocate for the eye protection that would cover a larger area. So like if you have one of those turtle big sunglasses, that would work, or those fancy Gucci eyewear that you thought you're not going to wear it till next summer. That actually is not such a bad idea. I haven't actually, I heard this today, so I haven't decided exactly what I'm going to do personally. I always wear glasses in the hospital just because I need to see. But I may need to get some kind of either a goggle cover or order prescription glasses that have a little bigger coverage. Of course, there are all these simple face shields that I don't know if you've been seeing being used, so those would also be pretty good. Idea is that when somebody is talking and a droplet is going through, you don't want that droplet. You want it to end up on a face shield or on a glasses, not in your eye. So that's a sort of the statement. So I think I'm done with that. Let's take questions, right? It was airborne. Well, so the reason I didn't specifically address that, droplets are micro droplets, of course, airborne. So the virus itself, it could be airborne, it doesn't matter. It can't leave the body airborne. It has to leave with the particles. And, you know, it can't kind of simply be in the air. It can be, but there's no mechanism of it to be released from the body in such matter, right? So it can't just kind of disperse itself off the surface of the mouth and lift and go airborne. It's possible, but it's irrelevant because it's not happening. What's happening is when you're talking, the micro droplets with the virus will take off, so to speak, but that's not airborne, that's the air droplet, okay? I don't know if that answers that question. Stephanie Jacobs, well, I think we introduced ourselves. I'm Dr. Misha Kogan, so if you, you can.
Hi, and thank you.
Is Johnson vaccine one dose? Yeah, that's what expected, Salome. There's an expectation that Johnson vaccine will only be one shot. And last one here that I see in all these months, it's never crossed my mind, but should people wear glasses instead of contacts? Yes, so that's the point. There is a thinking that the answer to this question is yes, because when you use the contacts, it's way closer to your eye, and a contact does not cover the whole eye. It's only covers a small portion of the eye, and there's a big area where virus can enter right on the side. So when you're using glasses, your area of protection is larger. So, Inessa, we talked about flu shot last session, but just to kind of recap, and thanks for joining, by the way, from Hawaii. Aloha, Inessa. So yeah.
Aloha.
This is the first year where I strongly recommend everybody, regardless of age, to get a flu shot. In the past, the recommendation was only people over 65 or those with chronic diseases should get it, but I think this is the year where I would say everybody should get it, just because, you know, concern if we get infected with both viruses simultaneously, nobody knows, but there's a fear that that's not going to be pleasant. On the positive, bright side, so far in Europe, where the typically flu season starts a couple of weeks earlier, we're seeing a very mild disease. And probably because there's very significant viral precautions with the using of the mask and social distancing. So hopefully we'll have a mild season. I'd say that this is the year where you want to practice every possible, optimize your immune system, take the flu shot, distancing, and personal protective equipment. All right, there are more questions suddenly, all of a sudden. Yes, so, and yes, I want everybody to wait till first or second week of October. The idea is that we don't expect flu to come before that, so that's next week or the week after. And remember, flu shots don't last very long, and you do want that coverage to extend into the spring. And there's no point in getting vaccine a lot later, let's say past New Year, because by that point virus mutates and the flu, and chances of that shot you're going to take later to be protective is going to be a lot lower. You want to create antibodies earlier on. That's the answer to that. But not too early, so they don't dissipate too early. Why face shield alone is insufficient? Because you're inhaling the air. So your air goes all the way around your face, your shield. And when you talking in front of somebody, say 5 feet away, 6 feet away, whatever it is, when you talking, you're inhaling the air. So those air droplets will go around the the shield. So that's the thinking. So you should probably wear both mask and the shield. Should we stop listening to CDC? All right, Christine, we're not a political organization. You have to answer that question for yourself, and to others. No answer from me. I'm impartial here. All right, but I am listening to my own institution and to my own chair of medicine. So CDC, you decide whether they're your authority. But I suggest that you do, because if you don't trust CDC, who can you trust?
Yeah.
All right. Is it safe to get fitted for new glasses or to have an old ones adjusted? That's a good question, although it was sent in private. Kathy, I say that if you have glasses that are working for you, I would use them. Fitted for new glasses. It's not really clear how much protection you really truly need. So I say if your glasses are very small, I would get the bigger ones. But if they're covering like this area, like this, even in front, so not necessarily like all around and tightly, you know how some people wear the skiing masks? That's probably overkill. So just any glasses supposedly should work. Okay, can you speculate? Let's do last questions, so then we move on to Luci's. Can you speculate what do you think will be the safety versus efficacy of the COVID vaccine? Of course, Inessa never asks simple questions, right? So let me put it this way. Generally speaking, vaccines are safe. If there are some possible complications, they're complicated for specific patients with specific predispositions. So, you know, generally speaking, the ratio of safety towards the efficacy will be, of course, towards the efficacy. So safety concerns will be much less. But you've seen what's happening in terms of the aggressive control of safety. So there's reason why AstraZeneca halted the entire trial and basically now trying to figure out what to do. It's because of one severe complication. So I think they're going to scrutinize the safety here more than the usual, like more than the standard annual flu vaccine. But you're asking the question that, again, of course, on everybody's mind. And I can only answer generally. I mean, I don't have the data to rely on, unfortunately, until I see that data, which is, they're claiming that the data is available on all current phase 3 trials, but I've tried to look at some of it, and I'll tell you, unless you are epidemiologist, to try to decipher what they're trying to communicate is nearly impossible. So even me with my basic biostatistical skills, I couldn't quite figure out some of the critical details, like how they calculate level of safety, the power analysis. But the reason they have such a high number of patients enrolled, so 30,000 in Moderna and 60 in Johnson & Johnson, that's exactly the reason. They're trying to say that, look, we've looked into enough number of patients to claim that the safety is adequate. Is that going to stand up to the truth? The problem is some of the complications may be delayed. Some of the complications may be in a very specific populations that may be underrepresented in these trials. So we're not going to have all these answers. The problem is when you're looking at the disease of this magnitude, you just don't have time to create the trials absolutely and create and execute perfectly. So there's going to be a degree of understandable bias and concerns that we have to accept as okay, because we need to have a treatment that's going to prevent us from getting sick. So I'll stop at that. And I think that's the last question. Perfect timing. And I'll go ahead and mute myself. Luci. Something with your sound and we cannot hear you.
Luci?
Yeah, I think your ear piece is not working because you're not muted. Do you want to try to turn off your, because there's a funny noise and no sound. Oh, those Apple buds. Boy, do we have fights over those in our household with kids.
Okay.
There we go. Perfect.
Okay, so earbuds are out. Hi, everyone. Thank you, Misha. Thanks, by the way. I've watched several of your recordings, and thanks. It's just such a gift that you're giving to everyone to keep everyone updated like that. So I'm a leadership and optimal performance coach. And what I do generally is to help people become better leaders and be their best selves in all situations and create the best teams and lead the best people through motivation and inspiration, which in my model is the highest level of leadership. Hi, everyone. It's nice to be here. Thanks for having me. So I have over 20 years of professional experience in business and leadership and health. And I have advanced degrees in business management, physiology, and nutrition. And I've helped myself and hundreds of others to create successful practices that balance a busy life with health and meaning. And before we get into the meditation, I just want to mention my new book. It's called Eat to Lead. And I'm talking with Leigh about coming back to discuss the book, but I wanted to share something special with you today because it's time sensitive. And that is that Eat to Lead is currently available on Amazon for pre-order. It's going to be released on October 1st. And I'm telling you this now because if you pre-order the paperback on Amazon between now and the end of the day, October 1st, you will get immediate access to the ebook, so you can start reading it right away. So that's like a 2-for-1. And I'm also offering other special gifts, a community of readers going through the book together and a growing library of recipes. And a hint for you is that it's not a diet. So if you're interested and you want more information, just head over to eattolead.com. And I tell everyone how to get the book and how to get the bonuses before midnight on October 1st. Okay, so now on to the meditation. Today, as we all go through this important shift, of course, it's important for us to stay grounded. And leader or not, in order to lead a change successfully in your life or with others, we need to have a vision of where we're going and what we want. Our vision can give us hope and meaning, and it can keep us moving forward, and it can give others hope and meaning too. So what we're doing today is a practice that I teach and do myself and also do with clients. And this is a signature meditation that I've evolved through my professional experience, as well as learning from a few of the masters, Tara Brach and Gil Fronsdale, and I've personally been meditating since 2006. So here's how it'll go. We're going to go through a relaxation meditation, and then we'll do a visioning practice. And in the visioning practice, I'm going to lead you to play a little video in your head. So before we get started, I want you to think about what part of your future you want to create a vision for. So this can be a goal that you have or something you want to have a positive outcome with, maybe a task you're completing, a conversation you want to have with someone, a project you're working on. This can be something slightly difficult or very difficult, depends on how deep you want to go. And this can be something that you want to have accomplished or found to happen by later today, or it can be next week or next year. So think of something now. What is it you're going to bring to your mind during the meditation? And during the meditation, I'm going to prompt you to think of things. At that time, the first thing that comes to your mind is absolutely perfect. Don't judge, just go with it. And if at any time you feel like you're finished with what we're doing, or you need a break from the visioning part, just go back to the relaxation segment, the first segment, being in your body and your breath and relaxing. Okay. So if there are questions, I'll take them before we get started. Okay. So I'm assuming you're all sitting, and if you're not, hopefully find a comfortable place to sit. And then go ahead and close your eyes. And Allow your hips and your glutes to settle into the chair. And feel your feet wherever they are on the floor, in the chair. And just let the bottom half of your body get grounded. And let it release and relax and fall deeper into your seat. Let's take a few deep breaths in through the nose and out, however you like. Feel the air moving through the nose into your sinus cavities in your head, down your throat, expanding your lungs. And when you exhale, just really let go, letting go of any stress that you might be holding on to in your body, letting go of any tension. And do this a few times, really taking the breath in, letting the belly expand with the inhale, feeling the uptick in energy when you inhale. And then completely releasing with the exhale. Yeah, just letting go of the energy. And every exhale brings the body into one notch lower into relaxation state. Letting the energy down another notch. And while we're paying attention to the breath, you can also allow your head to float towards the sky, light and airy like a balloon. And let your spine be like the string on a balloon, just floating up with the head. So the top half of your body is extending up as the bottom half stays grounded. Just a few more moments here. And before we move into the visioning exercise, just see if you can take any stress or tension down one or two more notches. Every exhale, breathe out any stress. So we're going to remain in our body as we move the mind into the future. Continue to stay relaxed, lifted, and grounded. And bring up that area of life that you'd like to do some visioning on. See a positive future for. Imagine yourself already having accomplished that positive future. Your goal has been achieved, and now you're basking in the results. We're moving way ahead here, and just look back. Feel how you feel Maybe it's proud or fulfilled or satisfied. Maybe it's grateful. This is future you looking back. And let that feeling come into your body. Enjoy it. And as you look back on what's happened, just see the end point of it. See the positive effects that happened as a result of your accomplishment. What does that positive accomplishment look like? Bask in the feeling of the outcome. Maybe you want to take it a step further and see the people that were with you or the environment that you were in when that positive outcome happened. Feel that, feel the energy there. And then we're going to take it a little bit further. And what did you do after? It could be a minute after, or an hour after, or that day, or a little bit later. After that happened, after the best thing possible happened with these results, then what happened? Then what did you do? Imagine yourself in that position, in that situation. And take your relaxed body and breath there as well. Now let's take it a step further. What is the ripple effect that that positive outcome had? Maybe it was on people or things or your life. Remember, whatever comes to your mind is perfect. Just see that ripple effect playing out in your mind while you remain in your breath and your relaxed body and enjoy the positive outcome. Go as far out into the future as your mind wants to take you, with the results of this positive outcome that you've created. Just a few more moments here. Just enjoy the way your body feels. Embody the success of your vision. Now slowly, with that vision firmly implanted in our mind, we're going to come back to our seat, being in our chair, our hips on the chair, feet grounded, spine lifted, head floating, body relaxed, and breath moving in and out deeply. Just noticing how we feel. And the final part of this meditation, I'm just going to end with some metta, loving kindness. So with your body and chair fully relaxed, call to mind someone or something that you really love. It's easy to love. Pull that object of love into your mind and just allow yourself to feel that love pouring out from you to them. Take your time. Feel how the body feels as you're feeling love. Now briefly, if you can, insert yourself in the place of that object of your love while you're feeling this loving kindness, turning that onto you, enveloping yourself in that. Hold on to that for another moment or so. And now we're going to turn that loving kindness out again. And we're going to focus it on everyone here meditating with you. Just sending loving kindness to everyone. You can even accompany that with repeating in your mind, may you always be happy. May you always be happy. And feeling that loving kindness come back to you as we offer and receive it back. And while we're accepting the loving kindness of others as it flows through the computer screens, go ahead and spread out your loving kindness just a little bit further, encompassing well wishes to everyone in your home, in your building, in your neighborhood. And then spread it out even further if you can. Just push it all the way around the world. Well wishes to everyone on the earth. Continuing to feel it come back to you. May you always be happy. May you always be happy. May you always know love. May you always know peace. May you always know joy. May you always feel safe. Now coming back to your place, mind in the body, body on the chair, body in the room. Take a few deep breaths and then slowly open your eyes. Okay, thank you everyone. And absolutely, if there are any questions or thoughts or comments, I'm open for that.
Thank you, Lucy. This was wonderful. Thank you. It's always hard to come back from this and then answer more questions. But we do have a couple of minutes if anybody have lost thoughts or just want to give us the feedback or anything like that. Janet put a couple of really good links. So there's a link to Lucy's upcoming book on the website, eattolead.com. And there's also a fun podcast on Science Behind Wearing Masks During the COVID Pandemic. So check that out. And everybody, if you don't know still how to do that, if you want to save the chat, if you click on the right where there's 3 dots, there's going to be an option, Save Chat, and it'll put it on your desktop. So you can always go back and look at all the links if you need.
Well, I think everyone is very relaxed, so mission accomplished, Lucy.
Exactly.
Great. I wonder if anyone had any comments or thoughts on the visioning part. That's usually very different for people.
That's probably very personal and individual. Each person have, unique take on it.
Most likely, yes.
Everyone's quiet today.
Oh, sorry, I don't want to put it on chat, but Dr. Kogan, what part of the face did you say should be covered with glasses? I missed the picture.
Oh, the eyes.
Okay, hi. So which part, how far?
Just any eyeglasses, unless they're very small. But if they're regular size, they should be adequate.
Should the sides be wider? I mean, the ones that hold your...
Probably.
Okay.
Yeah, probably the bigger the better. The more area of the eyes they cover is probably better.
Okay, thank you.
Yeah, those look pretty big. Why don't you put them on your face? So, yeah, that looks pretty wide. Yeah, they're pretty
Well, the sides are not that wide. I have another one that's wider.
So, well, if you have wider, use the whatever the wider.
Okay, thank you.
And fashion-wise, I don't think that's essential.
Okay, thank you.
I think the part of that I liked in your meditation was your trunk stays very grounded and the upper part of your body goes. And I find it very freeing, as if you are floating in the air and you're free to be who you are. So thank you very much for that.
Thank you, GD. I agree, and I feel it's a great embodiment to bring with you in many situations, especially if you're feeling nervous or scared, ground your body and then lift from the top. And it allows you to have exactly what you're talking about. Free to do, free to be, free to explore, be innovative, creative, and also
Grounded.
Yes.
Yeah. Yeah, great. Thank you.
Okay, if we don't have any more questions, everybody, I think we should wrap things up. Let me...
Who do we have next week?
Next week, I just put it in the chat, but next week we have integrative nurse practitioner Kimberly Cade and some acupuncturist by the name of Angela Gabriel.
Who is that, I wonder?
For those of you who may not know, Angela Gabriel is a acupuncturist and Chinese medicine practitioner at the GW Center for Integrative Medicine, and she's married to Misha.
Ah, I had a feeling that was coming.
She is the best. She is the best. Acupuncture is the
All right.
You're very lucky.
So Angela's going to talk a little bit about Chinese medicine approaches to illness, to viral infections, and just to how optimize one's immune system from Chinese perspective, not necessarily from Western. So that should be interesting.
So I take it she's why you put up with him.
Yeah, or the opposite. I don't know. I don't think she's listening. All right, everybody. We'll see you next Friday.
Have a good weekend.
Enjoy the weekend.
Thank you, Lucy.
Yeah, thank you, Lucy.
Janet, thank you, Dr. Kogan. Thank you all.
Thank you, Dr. Kogan.
Gracias.
Thanks, everyone.
Thank you.
Thank you, everybody. Have a good weekend.
You too.
Thanks. Janet, we didn't talk, but we are in pink.
It's my favorite color.
I was rushing, so I had to pull something.
All right. See you next week.
Yeah, see you everybody next week. Bye-bye.
Bye.
Bye, Claudia Joy.